Welcome to another edition of Let's Talk About It. This is Susan Johnson, and we have a wonderful guest for you here today. And of course, my co-host is doing great things, campaigning. He's running for office. Dennis O'Brien will be working to get elected to be on the Willimantic Taxing District Board. Of course, he had great experience as our probate judge, and then he went on the council after that when he had to retire from the probate because he aged out. But in any way, he's a great lawyer, and I'll be thrilled to see him get elected because he'll be able to help the town in so many ways. But with that said, we have a fabulous guest today. We have today Laura Cruz. She's the Director of Benefit Access with the Senior Resources Center, or the Area Agency on Aging. And I just can't thank you enough for being on our show today.
Well, thank you for the invitation. I appreciate it.
And this is great because, you know, Medicare is a very, very complicated thing. And it's because there's the need for supplements. And of course, Medicare started in 1965 in the Medicaid program too. And they've been helping people with access to health care for a long time. But there have been some changes since 1965.
There's a lot of changes since 1965.
Yes, there have. And I know you can keep us up to date because some of the things that we'd like to chat about today are the things that Medicare can do for people, and the things that maybe we have something called a Medicare Savings Program that some people may be eligible for, and then of course the combination of the Medicaid program and the Medicare program. So these are all things that are so important to our seniors, and this is the time because we have changes in enrollment.
Right. Well, now's the time. So
yes,
the
tell
annual
us about
enrollment
it.
period. Okay. Well, again, thank you for having me on the show. Again, my name is Laura Cruz, and I'm with Senior Resources, one of the 5 agencies on aging in Connecticut. We're all nonprofit, which is wonderful, and we all have what's called the State Health Insurance Assistance Program. We just call it Choices in Connecticut. And Choices counselors, you know, we're highly trained Medicare counselors who are not affiliated with any insurance agencies whatsoever, but we're here to tell you the good, the bad, and the ugly about the entire Medicare program. So right now, if you're actively enrolled in Medicare, you have a wonderful red, white, and blue card. You have to make plan changes for the upcoming year. You're probably being bombarded with a whole bunch of information coming into your mailbox. The open enrollment period it's already began October 15th, and it does end December 7th. I cannot stress enough for individuals who are actively enrolled in Medicare, and you must select your own prescription drug plan or a Medicare Advantage plan. Now's the time to open up that mailings from your current plans and ensure you know what they're talking about, you know what your changes are for next year. And when I talk changes, I am talking about the myriad of plans, especially the standalone drug plans, who have increased premiums quite substantially. Some of the plans I have seen have increased their premiums by $30 a month. And if you're not expecting that, it might be a shock for you come January when they mail you that nice booklet and says, okay, here's your premiums. What the Choices program does is we will sit down with you. Either we'll talk on the phone, we can Zoom with you, we have in-person appointments. I have events throughout our eastern portion of Connecticut, and we'll sit down with you and discuss the current plans you have now and how is it going to help you, or how will it not help you for 2024. And for pretty much, you need to make your decisions by December 7th for them to take effect January 1st.
Well, that is a really good start. And tell us, how can they reach you? Do you have a phone number people can call?
Absolutely. Senior Resources Agency on Aging, our local phone number. We're located in Norwich, but we do cover all of Middlesex, New London, Wyndham counties. For some strange reason, we have 5 towns in Tolland, but that's okay. But our local phone number is area code 860-887-3561. But if you're not listening in this area, but somewhere else in Connecticut, or maybe you have a family member that lives elsewhere in Connecticut, not in the towns we serve, Choices has a 1-800 number that will work inside the state of Connecticut that should get you to your area agency on aging with Choices Counseling, and that is 1-800-994-9422.
Wonderful. And if people are driving their car right now and they just want to Google senior resources or choices, what would come up if they did that?
Well, what they would need to do is Google Senior Resources Eastern Connecticut, and it will should bring you directly to our website located in Norwich. And it does bring up our entire agency as a whole, which besides Choices Counseling, we do have a lot of other programmatic information, especially those caregivers. We understand being a caregiver is a huge task, but definitely Google us because we'd love to have you come visit our website. We would also like for you to like us on Facebook. We put a lot of information, a lot of events that are happening, but if you were to look at your Facebook page and Google Senior Resources of Eastern Connecticut, we'd love for you to like our page as well.
All right. Well, that's good information because I'm going to go and make you a friend of
Oh,
mine.
oh, please.
Make you a friend. I want Senior Resources to be my friend on Facebook.
Yes.
I think that would be great. And let's just talk a little bit about I just noticed that you mentioned that Medicare Part D, the drug program, is going to go up with the premiums, but also sometimes the Medicare Advantage plan, which is Medicare Part C, the Health Maintenance Organization plan. Some people confuse it with other types of acronyms, but the Medicare A and B, Medicare A covers hospital services, Medicare B covers medical services with the doctor's visits and diagnostic services, and also A and B cover home care services. All those should be covered under the HMO plan. All the fee-for-service things would be covered under the HMO plan. And then there's Medicare D, which is, again, the pharmaceutical plans that sometimes are covered under the Medicare Part C, Medicare Advantage plans. But one thing that I found to be kind of interesting was the fact that if you have your medications covered through the Advantage plan, and then you go out of an Advantage plan, you may owe premiums in your Medicare Part D. Do you have the information on how someone would make sure that if they are in the Part C plan that encompasses A, B, and D, that they would know whether or not the Advantage plan was paying their D premiums just in case they left the Advantage plan?
So the tool that we utilize every day, and especially during open enrollment, we want to, and this is for anyone who's on Medicare, you want to utilize the Medicare.gov website, and they have what's called the Plan Finder tool. And when you do, you're able to input your medications and tell the program, I want to look at just Part D plans, or you can look at Medicare Advantage plans with drug coverage. And that is a great tool to get started with. You might have to look in other places too here and there for certain things. But we utilize the Medicare Plan Finder tool especially to go over the Medicare Advantage plans with the drug coverage. Because you do want to know, are you signing up for a Medicare Advantage plan with drug coverage that you might have to pay a premium for? And you might even have to pay an additional health plan premium on top of your Medicare Part B premium. So in order to enroll into a Medicare Advantage plan, you must have Medicare Parts A and B in order to get into that type of a plan, and then get your benefits through a private insurance company like an HMO or a PPO. But it's very important you understand what your financial obligations are with those types of plans. And what I do like about Medicare.gov is it does break down the premium listing about, you'll still owe Part B, but this has maybe a zero health plan premium, maybe even more of a premium. And then it will also break down if you have to owe an additional Part D premium as well. Looking at just the standalone drug plans, it's obviously just going to show you the Part D premiums only. And then from there, screening your medications it's really so important. It's no sense signing up for a plan that's not going to cover your medications. So if you're with straight Medicare, known as Original Medicare with a prescription drug plan, make sure you're signing up for a drug plan that covers all your meds. Same thing with if you choose to get your Medicare benefits through a private insurance company like an HMO or a PPO.
Well, let me just stop you there
Mhm.
with HMO PPO, because my understanding is Medicare Part C is a health maintenance organization. A subgroup of the HMO would be a PPO.
So actually, Medicare Advantage plans Part C can come in multiple forms of, how do I want to say, insurance plans. They have some that are strictly HMOs, and they have some that are PPOs, sometimes with an HMO component. So if you look at like the HMO/POS, that's available.
I could get it. Let's just, why don't we go HMO, Health Maintenance Organization. PPO is Preferred Provider
Federal
Organization. And when the 1996 law came into effect, making it more liberal for the insurance industry to have health maintenance organizations under Medicare Part C,
Mhm.
they were providing the capitated system of coverage. So what happens, my understanding is, with an HMO plan, every single Medicare beneficiary who enrolls, the federal government pays a premium for them for the whole year. And they don't pay any more than that. So whatever the Medicare Part C has, that's what they get for that particular person. Now, if that person ends up with a diagnosis of, say, a cardiac disease that needs bypass surgery, they're still going to get whatever the bottom line figure is for that particular person. And they'll have to expend more money for that. But that is, when you have an HMO, that's kind of how health maintenance organizations work, whether they're under the Medicare Part C or whether you're getting it in the private sector insurance industry. And again, it's another capitated way of analyzing it. Now, are you saying that Medicare Part C expanded to preferred provider organizations with no, with a different type of capitation?
Well, as far as capitation, I would not know that answer. What I'm saying is whether you have to stay in network or out of network. So when I talk HMOs, what I'm talking about is plans that you must stay within the network to get your care, unless it's an absolute emergency. If you're in another state and you're suffering something life-threatening, they have to cover you as if they're in network. There are PPO plans now that a person can enroll in, which has both in-network and out-of-network benefits. If you choose to go out of network under that PPO plan, you might pay a little bit higher. So instead of a set copay, say like a set $15 office visit copay, you may pay 20% of that total office visit. So they have expanded as far as offering other plans for beneficiaries, so they just don't have, their only option isn't just an HMO to enroll into. So when we talk HMO, PPO, I'm talking about the access to what somebody could get for care. And they're specifically listed. Anyone who's on Medicare now, you should be receiving your Medicare and You handbook. Should have already received it by now. I hope everyone did. If you don't have one yet, you can call our office. We've ordered extras. Very happy to share because I want you to have your Medicare information. But when you flip to the back of the book, it's going to show all the listings of the plans that do business in Connecticut, and that's standalone Part D plans. It's the insurance companies that sell Advantage plans, as well as the other plans that are called like the dual special needs plans. There's institutional plans now.
You can stop there. What's a dual special needs plan?
Yeah, a dual special needs plan it's part of the Medicare Advantage plan realm, so it's a Medicare Part C plan, but it's designed for somebody who has applied through the state of Connecticut and has been granted either full Medicaid, known as Husky C in Connecticut. So whether you're receiving home and community-based services, maybe long-term care Medicaid, or just maybe straight Medicaid in Connecticut. There's plans that are specifically designed for that particular person that's supposed to wrap more services around. But in order to enroll into that type of plan, you do have to prove your Medicaid eligibility. And that would be your letters through the state of Connecticut Department of Social Services.
Okay, so I've had a number of people who have gone through the Medicare Advantage plan and also were eligible for Medicaid and or the Medicaid Savings Program, which is a little bit higher eligibility rate, but still would cover you totally, completely for your fee-for-service Medicare, A, B, and D. But then someone will come, an insurance broker will come and say, well, you can have this plan. And then all of a sudden I find out from a constituent that, they don't have anybody who can provide, say, home care services, which are required for under the Medicare Part C. They're supposed to provide every single thing that A, B, and D cover,
Right.
or A and B cover in any event. And then, and so what I'm wondering is, how is it that they can get approved and not have a full network availability for somebody who is on Medicaid, would need to have, say, surgery and subsequently home care services, but can't get any home care services because that Advantage plan created a huge disadvantage for that particular person? How do we address that?
Yeah. That's when I'm going to call in my friends from the Center for Medicare Advocacy, a wonderful group located in Mansfield, and they really have the Medicare beneficiaries' the overall care in mind when they come, because they will go up to bat for you and help you. And when it is designed where, okay, your doctor orders specific services for you, you're absolutely correct. A Medicare Advantage plan must cover everything that Medicare Parts A and B does. And when it does come as an inadequate, coverage area, unfortunately, as far as the Choices program is concerned, it's quite difficult for us. So that's why we're going to get the experts involved with that and work with them, and they'll work directly with the consumer, the Medicare beneficiary, to ensure that the Medicare Advantage plan, who's supposed to be offering those services, does do what they need. And it might take a little time for that, but they're great people.
Well, they are wonderful people, but here we are now, somebody's discharged from the hospital and now needs home care services, but that particular Advantage plan creates a disadvantage because they don't have a contract with any of the home care providers. So the person is now struggling with a discharge plan that isn't working because while they may be eligible for home care services, their particular Medicare Advantage program creates a disadvantage that they will be struggling to get better. And what impact would that have on the hospital? It's my understanding that, say somebody gets discharged from the hospital to the home, with the hospital expecting a discharge with a home care service, and the person does not get that because the Advantage plan that they have doesn't have a network provider for home care services. And then the person gets injured again because they can't get the home care they were supposed to get. They must go back to the hospital in that case, and then the hospital takes the brunt of the problem because they will be fined by the federal government because somebody was just in the hospital, was discharged too soon, and then became injured again.
Right. Now, and if they do call Choices, we're going to take an entire look around what's going on. You mentioned something about if they are enrolled in the Medicare Savings Program, which for listeners, it's a wonderful program if you qualify because it's going to help you pay your Medicare premiums. And then it enrolls you into a whole nother federal program called the Extra Help Program, which helps with your prescription drug plan. But what it does do is it generates what's called a special enrollment period for you to perhaps leave the current plan you're in right now and get enrolled into something that would work. If the call comes into the ship, that's the first thing that we're going to see is, okay, let's take a look at your surroundings, what's going on. If it's an issue where they're outside of a valid enrollment period, because even with that help, they could have already used their special enrollment period for the quarter, or there's just so many instances where it may or may not work. Again, that's where we can help reach out to the plan to say what's going on, and if we don't get that good answer from the plan, a valid answer of why is it not paying, why are you not covering this area, what the client needs, then again, we will refer to CMA and get them involved because they do have the legal ability to do so.
And Center for Medicare Advocacy, and yes, and that their number is 860-456-7790. And if you've run into this problem with a Medicare Advantage program, and they have created a situation where you're at a disadvantage because they did not give a full opportunity for you in every single thing that Medicare Part A, which is hospitalization, and institutional care. Part B is doctor's services and diagnostic services. If they limited your access to these things, and these services that are fee for service, then in that case, call the Center for Medicare Advocacy, again at 860-456-7790, because I've had constituents here in this area, and I know in other areas in the state where they've enrolled in these Medicare Advantage plans, and they aren't fully I don't know why they were actually certified by the Centers for Medicare and Medicaid on the federal level, but they were, and they still did not provide access to every single thing they're supposed to provide. They're supposed to have a network of all the things that Medicare A and B cover. And let's just talk a little bit about, we've talked a little bit about Medicare Part C, which is HMO, Health Maintenance Organization, capitated program. The federal government, again, pays that insurance company for every single beneficiary a certain amount, and they don't get any more. So what happens is they want to make sure that they get plenty of money from the federal government to cover in case somebody has a medical need that goes beyond the amount that the capitation provides. And I say that because back in the day, now I don't know what the amount is now. Do you know what they're paying? I know that they're quite a bit over the fee-for-service plans. Say they're about 150% over what they actually need in terms of the money that they get under the Advantage plans. And also, when we looked at 2 years ago, when the Biden administration proposed putting in the fee-for-service plans, Medicare, those plans, having hearing, dental, and vision in those plans, the Advantage plan insurance industry people came in and stopped it. They lobbied hard to stop it, and so that's why they would try to do that, because they're getting much more than they need. But I'm just trying to say, what the problems are that I found that have been insurmountable, because people have really had a hard time overcoming these things. And as someone who worked with the Center for Medicare Advocacy, and then before that the Legal Assistance to Medicare Patients Program, one of the things that we found back in the day is that the appeals process is much, much different under the Medicare Part C / Advantage plans. How they do the appeals is a very different situation. You don't have the access to appealing a denial of Medicare benefits under the Medicare Part C that you would have under Medicare fee-for-service. So that's a different situation, and a lot of the information that you might get from a doctor who is working with you on a fee-for-service plan will be in a situation where they are having to work within that group of Medicare Part C instead of looking at them in a situation for being able to operate more on their own and independently based on what their ideas of what you should have for services and coverage and that sort of thing. So it is a very different thing. So I think right now we're going to stop for a break. This is Susan Johnson. I'm here with our very special guest, Laura Cruz, Director of Benefits and Access with the Senior Resources Area, or the Area Agency on Aging, also known as, and we will be right back after these messages. Welcome back, everyone. This is Susan Johnson. I'm here with our very special guest, a very timely guest, I should say, Laura Cruz, Director of Benefit Access with the Senior Resources Center, or the Area Agency on Aging. And we're in that special time of year where people can go and make changes about their Medicare enrollment. And this is going on right now. So when you hear this show, it's going to be time for you to just take a peek at what you have for coverage and see if you want to change it, see if you like it, or get some counseling just to make sure you have everything you're supposed to have. And so I'm really, really thrilled that Laura Cruz is here to talk to us. Now, we did spend in the first part of the show a little bit about the Medicare Advantage plans and some of the problems that you might run into with an Advantage plan. And of course, you hear lots and lots of commercials on all over the place on the Advantage plans. Not so much about the fee-for-service plans. Tell us a little bit about how the Medicare fee-for-service plans work. They're the old-fashioned plans, the plans that were the first plans that came out in the 1965 when we first had, well, actually, they were probably a little bit after 1965, but the insurance industry did work with Congress to make sure that they had a little bit of an in when the Medicare program went into effect. Because just a little bit of history here. Back in the day, and before 1965, insurance companies wouldn't cover anybody over a certain age because they felt that it was going to be too expensive. So you couldn't get insurance if you were a certain age, elderly, or you couldn't get coverage if you couldn't pay for it with a if you were low income, you couldn't pay for it, and so that was why we got the Medicaid program, and it really helped the medical industry. I have to say, gave a lot more support to the medical industry than they ever had, and it's still to this day, although it may be not as well known as to the huge advantages the medical industry has because of the Medicaid and the Medicare programs, and probably some with the Affordable Care Act now, but we're not talking about that. Anyway, so let's just talk a little bit about the Medicare fee-for-service plans and how many plans are there?
So let's talk briefly about Medicare Parts A and B. You know, as you were saying, 1965 when it comes out. I always say, Medicare would have been so much easier to talk about if we did this 40 years ago. You had A and B and that's it. You had nothing else. No Medigap plans to talk about, no prescription drug plan to talk about. It was there to cover you when you were ill. So fast forward now, some things through the course of the years have come into play, and voila, we now have, Medicare, you've got Medigap plans, and now as of 2006, need to add on a prescription drug plan. The original Medicare model, which was, again, designed many, many years ago, was essentially there to pay for when you were ill. You had mentioned at the beginning of the broadcast, you have Part A, which is your hospital insurance. You have Part B, which is your medical insurance, and and you can enroll pretty much when you're 65. Medicare, you can actually, it is available to some under the age of 65 if you do collect Social Security disability for 2 years. So it has opened up the door for a lot of younger folks too to get onto the Medicare program if considered determined disabled, I should say, by the Social Security Administration. The Medicare program is
and also don't forget kidney failure.
Yeah, and stage renal disease at any age. Honestly, it's you're not even collecting disability for 2 years. You could be at any age diagnosed with end-stage renal disease, which is essentially kidney failure resulting in dialysis or, quite frankly, a kidney transplant, unfortunately. So it is available, and it is a great mechanism to help pay. And now added on more to that part where you could actually stay on the Medicare program even when the Medicare benefits run out to at least help pay for those transplant drugs now. So that's wonderful.
That's such a change too, because back when I was doing this work, they give it to you, the transplant change medication, the immune response medication was ended after about a year.
Yes.
And now they certainly continue that, and we would all scratch our heads and say, why would they do that?
Right.
Because
now it's available, so great.
It's a wonderful thing. I couldn't help
it only took so many years to do that, but that's okay. But, with the original Medicare program, your red, white, and blue card, you do have access to care pretty much anywhere you want within the United States, as long as your doctors do accept Medicare assignment, I should say. Now, unfortunately, when I am counseling folks, one of the biggest misconceptions that I hear is, yeah, but isn't it free? I turned 65, so isn't it everything free now? And I'm like, no, unfortunately, no. The Medicare program is not free. Through your work history, you do pay FICA taxes. We pay Medicare taxes, and it does help you with enrolling into the Medicare program. But unfortunately, the Medicare program does have things called deductibles. It has co-pays. It has co-insurances. For your medical benefits, Medicare Part B as in boy, everyone has to pay a premium for that if you do want your medical benefits. So after I kind of go through what everything may cost, what's your out-of-pocket expenses, the next question, is there anything that can be done with that? And then we'll talk about Medigap plans. And a Medigap is exactly the terminology. It's to help fill in the gaps that Medicare says is your responsibility to pay. And there are about 13 different insurance companies in Connecticut that sell Medigap plans. And I don't know who named them, standardized by letters. In infinite wisdom, still I'm trying to figure that out. But there's all sorts of Medigap policies. You know, there's Medigap A, B, F, G, N.
But then how
there's
far
so
do they
many.
go? Because back when I was doing this work, they only went to Medigap A through F.
We now have G, K, L, and N.
And
As in
one of the
Nancy.
things that I found helpful was A through F, was at least you had a limited number. The more you have, the harder it is to figure out what you're going to want to pay for.
Exactly.
And I thought that was one of the things. I'm not going to do this too often, but I was at an Affordable Care Act meeting last week, and one of the things that I found was that some people thought there should be more plans, but when I helped design our Affordable Care Act system, I thought of the Medicare A through F. And I thought about, wow, this happened in the 1980s, I can tell you that, A through F did, because what happened before that is the insurance industry made the supplemental policies a la jumble. And nobody could figure out, and they had so many different plans, and they didn't name them in any particular way. And so then you got the A through F plans, and that happened in the 80s, late 1980s. And so that made it so much easier for people to figure out, well, what can I afford? What
Right.
if like F, for example, back in the day we could go out of the country with it, and it would supplement some of your medical expenses out of the country, and so you had those plans at the time. I won't even go into the details of each plan, but anyway, there were certain costs, and then the insurance companies that offered them, you'd see a scale and how much they charged for A, B, C, D, E, and F. And and each plan, of course, A, B, C, D, E, and F had to be the exact same plan.
The benefits, right?
Yes. So I didn't mean to interrupt,
No,
but
that's
that
great.
was
The
that I
background,
feel
yeah,
a little
no.
bit of the history here.
Right, and it's great that it has become standardized,
Yes.
because when I'm talking Medigap plans to someone and say they're telling me what's important. So with choices, we're going to take a holistic approach. Okay, what is important to you? What are you looking for? And that's when we want to discuss, okay, well, let's look at the Medigap rate sheet, because then that's how you're going to make your determination. What can you afford? A Medigap F is a great plan because you literally will have no Medicare Part A or Part B expenses that you'll have to pay, but you're going to pay quite a big, hefty premium for that. But if you became Medicare eligible on or after January of 2020, Plan F is not available to you. So anyone who has that nice red, white, and blue card that says their A and B begins after January 2020, they can't purchase a Plan F.
Oh,
Which
why?
is a
What
shame.
happened?
That is actually some laws that took place, both federal and laws. The federal government has said, unfortunately, any plans being sold from here on out, you're going to be responsible for your Medicare Part B deductible. So now, like Plan G has kind of replaced the Plan F. The only difference between the G and the F is you have to pay your yearly Medicare Part B deductible.
And that's based on your income at this point as well. The
Yes.
deductible Part B. So
No. Your Part B premium is based on what your income could have
I'm
been
sorry.
2 years ago.
my bad. My bad.
No,
Oh,
that's okay. No.
No, that was the Part B. The premium. So the premium is what you pay the first part of the year. Every year
Your
you pay your
deductible.
Part B. You pay the Part B
Deductible. Right. So your Part B, your medical benefit deductible, pretty much the first time you go to the doctor, I'm sure it's going to be wiped away. It is
What is it
raising
right now?
for 2024. I believe it's going to be $226.
Okay. And but if you're making more than a certain amount, it's going to be higher than that.
That would be your Part B premium. So so the deductible is the same for no matter who, but your Part B premium, Social Security is going to review your tax return from 2 years ago.
Mm-hmm.
So if you're becoming Medicare eligible 2024, they're going to look at your 2022 tax return. If you are a single filer, I believe they raised the income limit to more than $103,000, you'll pay a higher Part B premium. If you're joint filers, and I believe it's risen to over $203,000, you'll pay a higher Part B premium. Anyone below that, you'll pay the standard premium. And next year, with the cost of living adjustment that's happening, it will be $174.70 for 2024.
And
So that's taken directly out of your Social Security benefit if you're
Right.
collecting.
so one of the things they changed in the 1990s was the fact that they used to base it on your income solely, but now they take a look at how much under Part B home care, in the way of home care services are used, and then that is how they increase the premium amounts. So that was a change because they used to be very low, and then they decided to move around the home care services cost. At the same time, and this is one of the things that's had a very bad impact on the state, and I don't mean to digress, but I can't help myself. but what happened in the late 1990s was the fact that they did another thing where they capitated the home care services payments. And so back before that capitation on home health care services, it was unlimited. There was no change. If you had a situation where you had a chronic condition, you would be able to get home care services on an unlimited basis. With a capitation payment to the home care agencies, the agency said, whoa, wait a minute, we have so much money for this person who's going to be with us long past the time period that we're being paid, and we can't take this person as a patient now. So what happened there was they shifted the cost to the from the home care services to the skilled nursing facilities, and that cost the state more because Medicaid would have to come in after a certain period of time, and if they were really just home care eligible, they really weren't going to get coverage under the requirements of the skilled nursing facility coverage under Medicare. And so what would happen there is we created a program called Money That Follows the Person.
MFP.
Okay, no, please proceed.
No, and MFP, great program to get somebody who's in a facility back into the community. So
If you
that's
can,
wonderful.
but-
If you can, and still so many little pieces of the pie that have to be filled out when it comes to something like that.
But they really have to get the home care services, and now the home care services paid under the Medicaid program are not paid as much as they would be under the Medicare program. And so there's still some limitations in terms of getting access to home care services based on that change, that little tiny tweak that happened in the late 90s.
Well, I didn't come aboard till about 2005, so some of that may be
No,
prior
that's
to my
okay.
time.
I just count myself. I just
That's quite all
a
right.
little
No,
history because
yeah.
people wonder why is it like that, but that's why.
But getting back to Medigap plans is the Choices program creates a handy dandy what we call a rate sheet. So we take a lot of the information directly off the Connecticut Department of Insurance website, their listing of the insurances that can be sold, along with their standardized plans, A through N at this point. A few of them are not around, like J. You're not going to find anything about J. But the way the rate sheet is listed is if that plan sells that standardized plan, there's going to be a dollar figure in the box. So it indicates to you, oh, hey, you want XYZ insurance company, let's see if they sell the Medigap plan you want. On the back side of our rate sheet, it's the benefits schedule, quite frankly. It's what does that Medigap plan pay for. So I always tell folks is the more check marks in the box, the better the plan. More check marks equals higher premiums. So, and then there's go-betweens. There's actually the Medigap plan G now is also offered in a high deductible as well. So if your medical expenses are very minimal and you really only go to the doctor once or twice a year, you might want to consider enrolling in a high deductible Medigap plan, because then your premium is probably let's just say $75 a month. That's great. The deductible for next year though is $2,800. So before your Medigap plan is going to pay anything, you're going to have to incur, $2,800 worth of out-of-pocket expenses, but it will cover you 100% for the remainder of the calendar year. So it is a way to kind of budget if you need to. You have set premiums, And then again, you go to the doctor once or twice, okay, you know you're going to pay something, you know, and you know you're going to get a bill. So financially, you might be able to do some budgeting that way. So there's just a mixture of Medigap plans, and combined, when you utilize your Medicare and your Medigap plan, you really do have the freedom to move about the country, quite frankly. You know, it's easier access to care to ensure that you're getting what you need. No prior authorizations required. If you need that MRI because there's a medical reason, you don't need a prior authorization through Medicare. But that's not where it stops.
Well, through your insurance, I mean,
through Medicare.
Through the insurance Medicare Advantage plan.
Well, through
the MRI.
Well, through original Medicare, your red, white, and blue card, and a Medigap plan. Technically, there's no prior authorization needed for those types of services.
Right.
If you choose to get your benefits through a Medicare Advantage plan, please make sure you read or at least download or have a copy of what's called your evidence of coverage. If you can't sleep one night, it's going to be a great thing to put you to sleep. But honestly, when I'm counseling clients, I really want to make sure they have that, because it really does give the caveats to their entire Medicare Advantage plan. If you need a prior authorization, do you need a referral, and what your out-of-pocket costs are going to be for that particular item or service. So, when you come with choices, we're going to give you, like I said, the good, the bad, and the ugly about the entire program. If you do decide to stay with the original Medicare model, like your red, white, and blue card and a Medigap plan, don't forget, you need to add on a prescription drug plan. And for next year, 2024, there's 21 different plans available that somebody can choose. That's a lot. It really is. And it's very convoluted and it's frustrating to folks. I just want to say, give us a call. Let us work with you. If you work with somebody already, by all means, continue working with that person. We just want to give you the entire education you're going to need to make that educated decision how you want your benefits.
21 different Medicare Part D plans
Yes.
For your prescription medication if you're in the fee-for-service plans, which give you the chance to travel all over the country and obtain your coverage wherever you are. And I know that one of the problems that we have, if you have a place, a summer place in one area and you spend your winters in another area, you're probably better off, I'm going to just say this, but the fee for service, you're not going to have to worry about whether you're within the network, because you might run into a situation where you need surgery and then you're out of network, and then you're going to be in a situation that's going to create some difficulty, and especially if you need something that it doesn't have to be done immediately, but it must be done. You want to make sure you're going to be able to do that, and the network might not be available in the different state that you're in if you spend some part of your time. And many people do as they get older. A lot of people go from into the north in the summer months, and they go to the south in the winter months.
Right.
And many, my family has done that for
My family
generations.
does it too.
And so that's the thing that I would advise my uncle back in the day about, well, you want to make sure you have a fee-for-service plan. But somehow he always ended up with an Advantage plan, and then he needed surgery in Maine, and he had a heck of a time. But we won't go into that. Anyway. Go ahead. 2 more minutes.
2 more minutes.
So
Hey,
please, thank you.
Yes, thank you.
Wrap
Thank
up.
you. The only thing that I want to say is, hey, it's the open enrollment period. If you're on Medicare now, give us a call. October 15th to December 7th. In Eastern Connecticut, it's 860-887-3561. Just ask for choices. We actually have a live person who answers the phone, so that's a good one. So
Great. Now, how about Google?
Google Senior Resources Eastern Connecticut, and you should be able to find us. Same thing on Facebook. Find us on Facebook. Please like us, because we try to put out a lot of Medicare information, fraud, caregiving information, anything you name it that we do, we want to get it out there. So we would love to have you like us, and then you can share the posts as well.
Oh, wow. Laura Cruz, thank you so much. Director of Benefits Access at our Senior Resources Program here in Eastern Connecticut. You're going to be in Danielson.
Yes, some great people in my office will be. I personally will not be,
Uh-huh.
but people like me will be.
All right. Well, this is wonderful, wonderful opportunities for everybody to make sure you have the right kind of program for your situation. This is Susan Johnson, and thank you so much for listening, and we'll be back next week with another great show.